Welcome back to the channel. Today we're exploring a deceptively simple question with surprisingly complex answers. Why do life expectancies differ between the United States and the United Kingdom, and what does this really tell us? This isn't just about numbers on a chart. Life expectancy is shaped by everything from healthcare systems and economics to diet, culture, and inequality. So stick around because we'll break this down carefully. We'll cover average life expectancy figures, key differences in health outcomes, leading causes of death, inequality, lifestyle factors, and what governments and individuals can learn from these differences. 1. Headline numbers. How do they compare in 2025? Let's start with the headline figures as of 2025. United Kingdom. Average life expectancy, around 81 years. Women, about 83 years. Men, about 79 years. United States. Average life expectancy, around 77 years. Women, about 79 years. Men, about 74 years. That's a roughly 4-year gap overall, and even more between men in the two countries. 2. Has this gap always existed? In the 1970s, life expectancy in both countries was roughly similar, about 72 years. Since then, both countries saw improvements, but the UK's life expectancy continued rising steadily. The US saw gains slow down and even reverse slightly in the 2010s and 2020s due to rising chronic disease, opioid-related deaths, and inequality. This widening gap is a relatively recent phenomenon, a story of divergence, not a long-standing difference. 3. Healthcare system differences matter. As we discussed in earlier videos, the healthcare systems in these two countries are very different, and this shapes life expectancy. UK. Universal coverage via the NHS means everyone can access care regardless of income, employment, or insurance status. US. A mixed private-dominated system where access is tied to insurance and affordability. Millions remain uninsured or underinsured, leading to later diagnoses and untreated conditions. Access to preventive care, early diagnosis, and management of chronic diseases is more equitable in the UK, and this affects population health over time. 4. Leading causes of death, where the differences lie. United States. Top causes of death include heart disease, cancer, accidents, including drug overdoses and car crashes, stroke, chronic lower respiratory diseases. Opioid overdose deaths and gun violence also significantly impact life expectancy in the US. United Kingdom. Top causes of death are similar. Dementia and Alzheimer's disease, higher proportion due to older population, heart disease, stroke, cancer, chronic lower respiratory diseases. US deaths from external causes, accidents, overdoses, gun violence are much higher than in the UK, lowering the average life expectancy substantially, especially among younger adults. 5. Infant mortality rates. This is a striking difference. U.S. infant mortality rate, around 5 deaths per 1,000 live births. UK infant mortality rate, around 3 deaths per 1,000 live births. Higher infant mortality in the U.S. lowers life expectancy, significantly a reflection of disparities in prenatal and early childhood care. 6. Maternal mortality rates. Another critical difference. U.S. maternal mortality rate, around 17 deaths per 100,000 live births, one of the highest among developed countries. UK maternal mortality rate, about 7 deaths per 100,000 live births. The U.S. maternal mortality rate has risen over the past 2 decades, contributing to lower life expectancy for women. 7. Obesity and chronic disease. Obesity is a major driver of chronic disease and early mortality. U.S. adult obesity rate, around 40% in 2025. UK adult obesity rate, about 28% in 2025. Obesity contributes to diabetes, cardiovascular disease, and some cancers, all leading causes of premature death. 8. Inequality and life expectancy. Income and wealth inequality dramatically affect life expectancy within both countries, but even more so in the U.S. In the U.S., there's a 10 to 15-year life expectancy gap between the richest and poorest areas. In the U.K., the gap is about 8 to 10 years, still significant, but smaller and improving due to policy interventions. Greater inequality and weaker social safety nets in the U.S. contribute to earlier deaths for lower-income populations. 9. Smoking, alcohol, and lifestyle factors. Smoking rates, roughly similar in both countries, 13 to 14% of adults in 2025, though declining steadily. Alcohol consumption, slightly higher in the UK, but binge drinking more common in certain US demographics. Exercise rates, higher in the US, but offset by higher sedentary time and caloric intake overall. Lifestyle factors play a role, but don't fully explain the life expectancy gap. Access to healthcare and social conditions matter too. 10. Social determinants of health. It's not just medical care. Life expectancy is shaped by broader factors: housing quality, access to nutritious food, employment security, environmental quality, community support systems. The UK's stronger welfare state, Paid parental leave policies, sick leave standards, and universal health care reduce these risks more consistently than in the U.S. 11. COVID-19's lingering impact. COVID-19 reduced life expectancy in both countries, but the impact was more severe and longer lasting in the U.S., where excess deaths during and after the pandemic widened the gap. Pandemic response differences, particularly around healthcare access and public health infrastructure, explain part of the current 4-year difference in life expectancy. Summary. Let's pull all of this together. Life expectancy today. About 81 years in the UK and 77 years in the US, a 4-year gap and growing. Infant mortality, maternal mortality, deaths from external causes like accidents and violence, and higher rates of chronic diseases all lower U.S. life expectancy. Obesity and inequality exacerbate these trends in the U.S. Access to healthcare is more universal in the UK, helping reduce disparities. Lifestyle and cultural differences contribute but can't fully explain the gap. Social policy and healthcare system design play a major role. Bottom line, the life expectancy gap between the US and UK isn't inevitable. It reflects different societal choices about healthcare, inequality, prevention, and social support. That's it for today's deep dive into life expectancy in the US versus the UK, a topic that touches not just on health, but on values, policy, and how nations care for their people. If you found this video helpful, subscribe and turn on notifications. We have more comparative guides coming soon. From healthcare costs and taxes to retirement systems, business loans, and quality of life. And I want to hear from you. Do you think healthcare access or lifestyle matters more for life expectancy? What's your experience with health and longevity where you live? Drop your thoughts in the comments. I'd love to read and reply. Thanks for watching, and I'll see you in the next one.